Can we call the roll?
Jennifer Locke.
Present.
Charlene Murray. Here. Danielle Chandler.
I would entertain a motion for approval of the agenda.
So moved.
I second. Is there any discussion of the agenda? Okay. All in favor? Aye. All right, we have an agenda. Entertain a motion for approval of the minutes of the April 8th, 2026 monthly meeting. Second, matter of discussion in the minutes from the organizational meeting, it doesn't reflect that we elected Charlene as secretary. So I would ask that if we make an amendment to that, where we note that I was elected chair, Charlene was elected secretary. Danielle nominated her, I seconded, and it passed unanimously. Charlene was not here to protest. But if we can amend it to that, I would continue voting for it. So I move to amend it to reflect Charlene. Do you second?
Second.
All right. First we vote on the amendment. All in favor? Aye.
Aye.
All right. The amendment passes. All in favor of the minutes as amended? Aye. All right. We have minutes. It's time for public participation. Does anybody wish to? All right, we have no members of the public. Fantastic. Do we have correspondence from the director?
Yes, just a quick note that we finish our annual report and share a copy. If you have any questions, let us know. In terms of recruitment, we hired a new executive assistant, Amy Frederick. She's here. But as of right now, that's the only correspondence.
And moving on, we have old business, item 1, approval of revised 9200-03.01 contract and agreement signature authority policy. Is there a motion?
So moved.
I second. Any discussion of the revised policy? I have no discussion either. All in favor? Aye. And that passes. Moving on to new business. We have the treasurer's report.
The treasurer's report showing the financial statements as of March 31st, 2026. We have cash on hand of $7,291,497. Our total fund balance was just over $7.7 million, representing 42% of the budgeted expenditures for the year. We ended the 9th fiscal month with a deficit of $838,974. That's against a budgeted deficit of almost $1.6 million, so a little less than half of what we had anticipated to be at this time for the year. Our total revenue just over $11 million, which is $1.4 million under the year-to-date budget, made up mostly of being under budget with the property taxes of $277,000. Grants and contracts were under their year-to-date budget by $1,030,000. Fee for services were under their year-to-date budget by $214,000. Our total expenditures for the first 9 months were at $11.8 million, which is $2.1 million under the year-to-date budget. Again, mostly due to personnel being under their year-to-date budget by $500,000. Frenchman dispatch $52,000. Contractual services under their year-to-date budget by $593,000.
Are there any questions? I have none either. Is there a motion to place the treasurer's report on file?
So moved.
I second. If there's no further discussion of that, all in favor? Aye. Okay, moving on. Item 2, approval of payments to the Board of Health appointees. We can do this in an omnibus. We have Treasurer Ron Fields for April 2026 services, and also B for Attorney Ruth Wyman for legal services between March 16th, 2026 and April 15th. Is there a motion to approve these payments?
So moved.
I second. Any discussion? None either. All in favor? Aye.
Aye.
Okay, all getting paid. Next, we have the review of monthly credit card statements. And reading through them, everything looks appropriate to me. Is there any questions?
No question.
Okay. I would entertain a motion to place those on file as well.
So moved.
I second, and all in favor?
Aye.
Okay. Next up, we have approval of the 2025 annual report. We received it. I haven't had a chance to look through it. Thank you for the advance copy. Is there any question?
No question.
No. I do enjoy going here. We don't have our accurate titles listed, but it's from last year, so reprint. No, do not, do not. All right. In the absence of any further questions, I move to place this on file. Okay. All in favor? Aye. Okay. Moving on, we have approval of contract between CUPHD and Hookton Community Memorial Hospital for East Central Illinois HIV Care Connect services from April 1st, 2026 to May 31st, 2027. Is there a motion?
So moved.
I second. Any discussion?
No.
I have none either. All in favor? Aye. Okay. Motion passes. Number 6, approval of the 2026 rate card for advertising of Smile Politely. Is there a motion?
So moved.
I second. As a point of just question here,
Yes.
what, it's the rate card, but this isn't a contract, so it's just letting us know that if we use them, this is how much the rate will be?
Yes.
Okay, and it's for the full year?
Mhm.
Okay.
And we have been doing this before.
Okay.
and Just, yeah.
Awesome, great, I assumed so.
Yeah.
Just wanted to make sure, I was like, did I miss a contract? Great. And,
No questions. I
Okay.
was gonna ask if it was continued, but you've already answered it.
great, and all in favor?
Aye.
Aye. Continued. Number 7, approval of agreement between CUPHD's Great Start Program and Tanya Blackshear, licensed clinical social worker for consultant services from July 1, 26 to June 30th, 27. Is there a motion?
So moved.
I second. Any discussion? I have none either. It is a great program. All in favor? Aye. Okay. Turn the page. Now we have approval of bids. We will do these separately since they're separate companies. 8A, Main Street fencing for additional storage cages in the basement. Is there a motion?
So moved.
And I second. I do have a question.
Yes.
What are we putting cages in the basement for?
Yes, great question. So we have, I don't know if you've been to our basement, but we have a spacious basement. And the idea is that, to put cages for each divisions. So we have our organization is growing and we have many materials. So for each division to have a place to store their materials for event. But also, during COVID, we had a lot of donations, and we just want to make sure that those donations are safe and protected in case of emergency. So we're gonna just put cages out there with lockers to protect them.
Great. Any further questions?
No.
Okay. So we have a motion and a second. All in favor of awarding Main Street fencing this contract?
Aye.
Okay, the motion passes. Next, we have B, CS Construction Group LLC for repainting of columns in the basement. Is there a motion?
So moved.
I second. Is this also just part of the
Yeah.
basement redevelopment?
Yep.
Great. All in favor?
Aye.
Aye. Okay, finally, we have C, Freedom Fabrication for harm reduction vending machine cover. Motion?
So moved.
I second. Yes, thank you, go ahead.
Yeah, so we have a great our reduction program within our teen and adult services, and we were able to secure a grant to purchase vending machine to distribute all related services such as Narcan, condom, like all type of services for people free of charge, but they need to have a code to get access to those. We just want to make sure that it's a very expensive vending machine. We just want to make sure that the vending machine is protected for storms, snowstorm and winds, just normal wear and tear and stuff as we move forward.
$6,600 well spent. I do have one note, and it's really just, it's not about what we're doing here,
Yeah.
it's about on this. In, I'm going to the right one. In the calculation on page 83, it lists 5 points for a veteran or disabled contractor,
Mhm.
but then in the questionnaire 2 pages later,
Mhm.
that is marked as no. So even if we accidentally, filling out the form, calculated those extra 5 points,
Mhm.
if we take those out, it's still the highest scoring and it's still the lowest bid. So it's really just a matter of like, just cleaning up our bookkeeping here, making sure we're letting the public be aware.
Yeah, yeah.
That was a clerical error likely, but even with that error, it's still the highest score and the lowest bid. So I still support it, even with that. Do you have any questions?
I just want to say that that process is very, it's very thorough. Maybe that's
Yeah.
that's a an error from their part, but this is a team of 4 or 5 people,
Yeah.
and they come. Criteria was set by the board, I believe,
Yeah.
and they come and go through this bit and based on the scoring and the lowest price, they
Yeah.
go with that. I don't like to be involved in it because I really trust the process.
Yeah, I love the process. I've been trying to implement that on another board that I sit on. It's a great process, and it kind of makes it an objective, but
Yes.
still maintaining our values. It's great.
Yeah, and anytime that we choose, we haven't had anyone that goes through the bid and come back and say, hey, that process wasn't fair, or
Yeah.
since I'm here, we didn't have that.
I love that. No, it was really just because the questionnaire said no veteran, and then the calculation sheet said yes. And so I just wanted to make sure that we, even if that one's not correct, it's still highest score and lowest. So it was, it's still good. So in the absence of further discussion, all in favor of awarding Freedom Fabrication the contract for the harm reduction vending machine cover? Aye. Okay. And that passes. Moving on, number 9, approval of media campaign agreement between CUPHD and Surface 51 for reducing youth and young adult use of electronic cigarettes. Is there a motion?
So moved.
I second.
I just want to mention that we, I think in our last board of meeting, we went through this just to make sure that you guys are all aware, but I think this is just an approval.
Yeah, this is just an approval. It's pricey, but it's good. And because to reach the young adults, we have to go where they are, and that's all online. So.
And also, like, after we went through the meeting process, this was also the best score
Yeah.
that we got. So, and we are, Surface 51 is a local vendors. We're very familiar with their work, and they're very gracious to us.
Yeah, we're big fans, big fans. All in favor?
Aye.
Aye. All right, that was number 9. Now we come back to Surface 51 when we get down to the check requests. We'll do them separately. 10A, Surface 51 for tobacco prevention media campaign. Is there a motion to approve that check? I second. Any discussion?
No discussion.
Okay, all in favor?
Aye.
Okay. 10B, Douglas County Health Department for March 2026 Illinois Tobacco-Free Communities Activities. Is there a motion?
So moved.
I second. Any discussion?
No.
I have none either. All in favor?
Aye.
Okay. Number 11, ratification of check request payable to A, Zobrio for FE/NXT annual subscription year 3 of 3 from May 29, 2026 to May 28, 2027. We'll do that concurrent with B since it's the same company. Zobrio for FE/NXT client care agreement, July 1, 2026 to June 30th, 2027. Is there a motion to accept or to ratify these 2 check requests?
So moved.
I second. I do just have a question.
Yes.
It's year 3 of 3. How's
Yeah.
that working out for us? Are we thinking of continuing or?
So that's a software from our finance department, I believe.
Ratification.
Oh, no, I'm just asking about Zobrio. We're in year, we're in year 3 of 3. Are we satisfied or is this going to have to go up? Okay, great. Then happy to continue paying them. I have no further questions. Do you have any?
No question.
All right. Then all in favor of ratifying 11A and B?
Aye.
Okay, those 2 to the same company will get paid. Next up, we have C, City of Urbana for environmental health license fee reimbursement from April 1st, 2025 to March 31st, 2026. Is there a motion?
So moved.
I second. I, as an Urbana resident, was excited to see a list and address of every single food establishment. I plan to go to. Any discussion? Okay. All right, all in favor? Aye. Okay. Next up, we have Ford County Health Department for Narcan Quarterly Subaward, and also E. DeWitt Pyatt Bi-County Health Department for Narcan Quarterly Subaward. Okay, I second, and any discussion, please?
No discussion.
Okay, I only see that we're awarding a quarter of it. Is there, if it's a ratification, I'm guessing that the check has gone out. How much is that?
Can you come in?
Sure. The subcontracts that we have with the health departments typically are $10,000 to $15,000. We had a bit of extra money this year because of a staffing shortage that was mentioned earlier, and so we were able to give some extra dollars out to those health departments who have increased work because we've been downstream.
Great,
Yeah,
thank
and
you.
Amy just showed me the numbers. So for Ford County Health Department, it's 7,500,
Okay,
and then for DeWitt Pyatt Bi-County Health Department, it's 5,000.
okay, great, thank you. I have no further questions.
No.
Okay, then we will vote on D and E. All in favor? Aye.
Aye.
Okay. Moving on to 11F, Champaign County Public Health Department for Tobacco-Free Communities Grant, January to March of 2026. I second. Any discussion? No? Okay, all in favor? Aye. All right. Next up, designation of the budget document as the financial year 2027 tentative budget and appropriation ordinance 2026-601. I'm assuming there is a presentation, or are we just?
I can give you one.
Yeah, just a brief overview. Just a brief.
The budget has a budgeted loss of 2.9 million, not abnormal for us. Capital improvements is 905,000. And that includes 9 air conditioning units and control boards, remodeling of the WIC and health works, and parking lot resurfacing is the majority of it. The rest of the budget loss will be made up for IMRF for the early retirement incentive. We are going to use, or we're planning to use, the surplus that we have with IMRF for part of it. I could not get confirmation, so I had to budget for the entire, everybody, regardless. I don't expect to use it. Health insurance went up about 10% on average, and the fund balance, if we were to spend it all, would put it down at 23% versus the 25%. But like I said, I don't plan that to happen, so we're still within range.
So if this went as printed, not as we expected to go, we'd be outside of our goal of 25 to
Yeah.
50, and there'd be harder conversations, but we don't actually expect to get there
Right.
once we get the information. Okay. Thank you. We set maybe these there. I didn't like that number. All right. Do you have any questions?
No.
All right. How did you want to get insurance to 10% increase? This is a conversation for later, because at the county, we went up 30 last year. 10 is more.
Well, we're part of Central Management Services,
Okay.
and so they have several employer groups throughout the state, so it's a larger pool to pull from.
Thank you. All right, related to the budget, I have no further questions.
No question.
All right, this is, if I'm right, this is something we don't vote on now, it has to sit open for a month, right? Or maybe? Or
I
is it-
think
are we voting on
that's-
it now?
Well, it's just a designation
Okay.
right
Okay.
now of the budget document.
Okay.
So I suppose a motion and a second and a vote to, yes, designate that, pages 159 through 324 of the packet, but that as the budget document for tentative budget and appropriation ordinance.
Okay, great, and then we vote on the actual budget next month, right?
I think that's right.
Okay, great. All right, well then, we have a motion, we have a second, already, I think. Maybe we don't. Do we have a motion and a second on this? We do not, okay. Okay, is there a motion?
So moved.
I second. All right, all in favor of designating the budget document from pages 159 to 324 for the appropriation ordinance?
Aye.
Aye, all right, we have done that. Pending grant contracts for the administrator, there are none this month, right? All right, next meeting will be on a different schedule, will be at June 17th at 5 PM. And with that, we call this meeting adjourned at 5:24. Is there signature somewhere?
Not right here.
I do.